Goni skill hip external rotation. Position the patient sitting over the edge of the table with the knees flexed to 90 degrees. Make sure the hips are in 0 degrees of abduction and adduction and in 90 degrees of flexion. Be sure to test the unaffected limb first. Place a towel roll under the distal end of the femur to maintain the femur in a horizontal plane. Flex the contralateral knee beyond 90 degrees to allow the hip being measured to complete its full range of motion. In patient-appropriate language, ask the patient to externally rotate the hip while you assess the distal end of the femur for abduction, adduction, or further hip flexion. Observe for any rotation and lateral tilting of the pelvis during the movement. Apply a force at the distal tibia to move the lower leg medially as you keep one hand at the distal femur to provide stabilization. The hand on the distal femur will also hold the lower leg in a neutral position to prevent rotation at the knee. The end of range of motion occurs when resistance is felt and further motion causes tilting of the pelvis or lateral flexion of the trunk. Assess the end feel of the joint, which should be firm because of the tension in the anterior joint capsule, iliofemoral ligament, and the pubofemoral ligament. Tension in the internal rotators may contribute to the firm end feel. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the anterior aspect of the patella. Align the stationary arm so that it is perpendicular to the floor or parallel to the supporting surface. Align the movable arm with the anterior midline of the lower leg using the crest of the tibia and a point midway between the two malleoli for reference. Ask the patient to perform hip external rotation as previously done, maintaining the goniometer in alignment through the entire range of motion and observing for any extraneous movements of the pelvis and the femur. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document in the patient's chart. The average range of motion, according to the American Association of Orthopedic Surgeons, is 45 degrees.